I would like to congratulate all of you for coming this afternoon. So just a big round of applause for all of you. The people don't take that initiative, they don't take that step, of coming forward and learning. And when we were discussing, Sonika was discussing with me and I was like, yes, it is very important these days for parents to have right information. Because we also as parents forget about the children. We also sometimes we don't have access to the right information and what kind of things are going around in this world. So I've tweaked my session a little bit. So we will be talking about the vision in children, not only in terms of digital aspects, but as a whole. So as parents, we would be looking at through this session today that what are the signs of eye problems in children. Because you see the children are those people who rarely complain. They don't complain because for them there is no abnormality. उनको नहीं समझ में आता कि abnormal क्या है. They don't come with symptoms. They will not tell you that I am having eye strain, I am having blurred vision, or I am having something. So it's the signs which we as parents we have to pick. We'll be talking about some physical signs, behavioral signs, and some common complaints which children might make. Then we'll be also be understanding about what is the eye care for children. So like lot of mothers they ask कि हम लोग लेकर के गए examination के लिए and it was not possible to check the examination. So first of all we'll understand what are the healthy habits for healthy eyes, and we'll also understand how the detection should be there, and understanding if there is any problem which is detected, how it can be corrected, and then we'll be also be taking one-on-one questions with you. So before that, just warming up and just let me try to understand कि आप लोग कितने aware हैं, कितने conscious हैं. Let me just ask you, what do you think is wrong here in this picture? Distance. Okay. So what is wrong with the distance? It's very close. Okay. And flashy light. The light is very strong. And very wrong posture. Very good. And what do you think is wrong here in this pic?
No interaction, no social.
Yeah, even though they are sitting among their friends, still they are alone. So there is no socio-emotional development which is happening. What do you think is wrong here? Yeah, not only while driving, even the person who is crossing the road, they are also busy on the mobile. So it becomes life-threatening, right? Now coming back to our sweet little children, what do you think is wrong here? Rubbing, frequent rubbing of eyes. And what do you think is wrong here? Vision is blurred. They try to squint their eyes and see. Eyes को ऐसे करके देखते हैं. They try to make funny faces. What do you think is wrong here in this picture? Squint. Oh, very quickly you pointed out that. We can see that the eye alignment is not normal. Now I will give you a little tough one. Tell me. Eyeball is large. Okay, then what else can you notice? Little squint.
Mala is dry because even it's not working.
No, even doctors cannot detect dry eyes by seeing the picture. But still, okay, maybe he's not able to see properly and he's making a lot of effort to see. So my dear worried mothers, it's a perfectly normal child with normal vision. So sometimes we're so worried that we see abnormality in everything. Okay? So I'm not here to make you finicky about vision problems, but to just make you understand and make you aware about what are the things that we need to take care. So first we'll see signs. So why signs? Because it's our duty. Child will not complain. बच्चे नहीं बोलेंगे उन्हें क्या problem हो रही है. It's we have to pick what are the problems. So first, the child can have a cross eye fixation. दोनों eyes उसके अंदर की तरफ जा सकती हैं and they might not be looking straight, and that happens with a lot of children. One eye that turns in, out, up or down, like how you pointed out in that picture, there was a squint. Then you can have crusty, swollen, bloodshed eyes, redness, abnormal redness in the eyes. Then eyes that water a lot. Watering problem is there. It's there with the smaller children also who are infants. There's discharge, bleeding, red bumps. The pupil, this is very important. The pupil that looks white instead of red in the color photograph. I'll just show you what it is. And difference between the two eyes. For example, the one eye appears to be bigger compared to the other. And there is a difference in size. And you see this black part of the eye. And probably the size difference is there in that also. So let us try to see, this is the crossed eye, where the person is looking towards the nasal side, towards the nose, and they're not able to straighten their eyes. And this is very common with the children. And we see the eye turning outward or inward, which is a squint. This is red eyes. Red eyes भी बच्चों में बहुत common है because they're playing in dust, they're touching everything, they're putting on their face. And what do you do when they get red eyes? Splash. What water? Cold water, tap water, or drinking water? What do you think should be? Tap water. So tap water, do you think is ideal? If somebody is having redness, if I ask them to wash their face or eyes with just the tap water, do you think that would be ideal? Chlorine content is very high, especially in Jaipur. If you see, even our taps, they get this white scaling. Do you see that? You got a lot of that thing also. It's probably not sterling, and we don't know what kind of microorganisms are there, and we might be accelerating the infection and become worse. Potable water is safer. And what else we do sometimes wrong? There are a lot of people, you just go to a local chemist. वहाँ पे मेडिकल वाला होता है, we ask them ये redness हो गई कोई eye drop दे दो, कोई दवा दो. What they do is, मैडम ये ले लो रामबाण, एक दिन में सब खा. So what is happening? Not only in terms of eye, but in terms of our health also, we are exposing our young children and probably ourselves also too much of antibiotics. And these antibiotic uses, overuses, Dr. Rashida will agree with me, creates an antibiotic resistance. So जब कोई severe infection actually में होता है, तो वो antibiotics work नहीं करते, and we are not left with any other option. Or they will give you a steroid. वो steroidal eye drops देंगे, एक बार डाला, एक बूंद में डाला, सब काम. We are happy, अच्छा ही था. But over the period of time, there are a lot of long-term problems for the eye which can happen. Red eye can be there because of sunrays also. Yes. Now see, this is what I was talking about. So when we take a picture, normally, especially in child, because their pupil size is bigger, you see this sort of a red reflex which you see there. So you see something different in the two eyes. One eye is having a red reflex, one eye is having a white reflex. So it is not normal. So you should just simply remember that it should be similar. And if it is not, then it is an emergency sign. Immediately the child has to be brought to an eye doctor for a thorough examination. Okay? Without a picture, while taking picture becomes very prominent. Normally, since our eyes are very dark, we are not able to notice it until unless the picture is not taken. And if it is noticeable even without taking a picture, then also it is a sign which we should not neglect. It could be an eye tumor. This is the case of retinoblastoma, which is an internal eye tumor. So now coming to the behaviors. बच्चे क्या करते हैं? Complain नहीं करते, वो adapt करते हैं. They adapt very fast because they don't know what is abnormal. So they adapt a behavior which is not normal according to us, and we should be aware about those behaviors. Now closing one eye to look at something. Sometimes kids, what they do, if you take them to bright lights, certain children they try to close their one eye. Even for studying also they tend to close their one eye. So if that is happening, what if it is an indication they are not able to use their two eyes together? As simple as that. They need an eye examination. Second thing, abnormal turning or tilting of head to see. So we call it, certain children you will see around, they adopt a certain head posture. So we think that okay, probably it is a habit which has been developed because of poor posture. posture, but sometimes it can be an indication to a vision problem also. Squinting to see, as we saw in that picture, they try to make these eyes shut and try to see clearly. Not seeing things, you point out. You point out something, oh, देखो क्या है उधर, try to read that, and they're not able to, they just run, and they go close and they try to read. They hold objects very close to the face to see them. It is an indication. Sitting very close to the TV. And sometimes as parents we see that, oh, probably it is so engaging, that is the reason why the child is sitting close, but that's not the case. There might be a vision issue also. Blinking or rubbing one eye or both eyes a lot. And if that is there, again it is an indication that there can be a vision problem. Running into objects. Now this is something new. Most of the earlier ones probably you knew it. Running into objects and bumping into objects frequently. What does it mean? बच्चा है, खेलते हैं, बच्चे गिरते हैं, but there are certain children which you see that they keep on bumping into something or the other. If you probably ask them to walk from here to that gate, that child will not be able to navigate. They'll probably hitting some chair, some table, and it is can be a vision problem because their navigation skills have not developed. So when we talk about vision is not just seeing 6 by 6. Vision is also about utilizing that visual information for navigation. So if there is an issue, it could be a vision problem. Falling down at night or in places that are not well lit. जहाँ पे dark spaces है, contrast कम है, their judgment becomes. The child cries. What a child will do when they are not comfortable, the child is small, they will cry. If a child is a little older, they will run away from that place. They will be scared, or they will fall. They will have poor judgment skills there. Then we have very short attention span. This is very important. Every child has an attention span which is short. It has to be that way. There was one mother, Nandini, was telling us that probably I am confused whether my child are abnormal, who are just running around 16 months old with the entire restaurant, or that child is abnormal who is sitting silently with the mobile phone. So, my dear mothers, the brain learns, the children learns through the physical exposure. So child has to be exposed, child has to go around and has to discover. And when we notice in certain age of children, it's like 5 years, 8 years, 10 years, and we see that they have some attention issues, what we think normally, हम लोग क्या सोचते हैं कि आपको कोई विजन प्रॉब्लम होगा, तो हम क्या करते हैं विजन प्रॉब्लम के लिए या तो हम किसी जनरल आई डॉक्टर के पास में ले जाते हैं या हम किसी ऑप्टिशियन के पास में ले जाते हैं. बच्चे को घटाता है, child is able to read more or less accurately. They feel that okay, there is no other issues, so you end up landing into a psychologist or a psychiatrist. Now the psychologist and the psychiatrist, obviously, they are also not vision experts. They see okay, probably it is okay, and the majority of children who are unnecessarily put on medications and they are labeled as having attention deficit disorders. But what is the problem with them? That they are not able to have sustained focus. Like how our running speed is different for each one of us. अगर कोई तेज भाग सकता है तो थोड़ा धीरे भागता है. Same way, the attention span or probably the focusing skills are also different. And if the child is not able to focus, he will not say, I'm having a headache, I'm having eye strain. He will just run away from that. And we will be thinking that, okay, child is not ready to study, he is having attention deficit disorder. Confusion in the left-right orientation. This is normal till about 4-5 years of age. But even after that, 6-7 years old child, 8-year-old child, a 10-year-old child having severe confusion in left, right, so there is a problem which we need to see. Confusion in orientation of letters, difficulty in understanding between B and D, P and Q. There are a lot of other things. So there is difficulty in differentiating similar letters or icons. And listen to what your child says. The common complaint a child sometimes makes and we tend to ignore, they can't see. Things look blurry or funny. So there was a small child who came to us and her complaint was that when I'm excited, when I'm too happy, the little start dancing. Parents were not understand, were not able to understand that. And what was actually happening, there was so much of neural extra flow which was not controlled that when she was excited or happy, she used to have double vision. So it had to be balanced. There can be such problems also. They were in the eye, they were feeling something in their eye, they feel pain. The light makes their eyes hurt. So these are some common things which you can listen. So what is the thumb rule for eye care? So first thing is prevention. So now the important question comes: how do we see things? Now when we hold a mobile, normally we hold a mobile at this position, right? And whenever you are reading something, it is at this position. And when you are watching TV, you are using a bigger distance. So smaller the device, the closer is the working distance. Now we'll do a small thing. Everybody, just put your finger forward like this. Just try to look at your nail, focus on that, and slowly bring your finger closer towards the center of your eyes. Now what do you notice? As the finger comes closer, what do you feel? You feel a strain? You feel there is a conscious effort which our entire system has to make. So if this constant system is there, child is using lot of mobile phones at a very close distance, so what is going to cause? It is going to cause an abnormality, an abnormal function, an overuses of some function which is not meant to be that way. So जब हम दूर देखते हैं, our eyes are perfectly relaxed. But when we are looking something at very close, our eyes have to make an extra effort. Always ask your child to sit upright, maintain an adequate distance. Don't avoid using glasses. Use ambient lighting. We'll understand this. Try to think more. So see, this is how. Even we as adults, sometimes when we sit, we tend to sit like this. Even we also as adults and children also. और बच्चों का क्लियर होता है. आप भी ऐसे करते हो तो मैं भी ऐसे करूँ. And you cannot justify that. आप भी ऐसे यूज करते हो, मैं भी ऐसे यूज करता हूँ. और आप भी तो बेड पे लेट के मोबाइल फोन्स देखते हो, तो I am also doing that. So what's wrong in that? So they learn from us and they try to imitate us. So ideal posture is like this. So if they are having an online class, they are studying for study purpose also they have to use. Always make them to sit upright. Give them the bigger screens, not on the mobile phones, and ask them to sit upright. Use ambient lighting. Here you see ambient lighting. In the first photograph that we saw, where the child was using this mobile like this, all the surrounding lights were off. What it was happening? You have to strain your eyes a lot. So whenever a child is using mobile phone, or even we also as adults, there has to be certain amount of surrounding light which has to be on. So this is called as ambient lighting. So now there is a new arrival in the family. So when a child is born, or when a new car which comes. So when a new car comes in the family, what does it happen? What does it come with? We are so much excited. The company says we'll give you 3 free services or 4 free services, right? And they clearly say we all must be driving cars that either 5,000 kilometers or 3 months, whichever is earlier. Yes or no? But do we do that for our eyes? Or we wait for the problem to come? So let us try to understand when should actually, as per the American standards, because that is what we all follow in everything. So what are the standards for eye examination and when it should be happening? So the first eye examination for a child has to be between 6 to 12 months of age. Many of us think child तो कितना छोटा है वो कैसे पढ़ेगा चार्ट, because that is what we are used to. शायद आई टेस्ट ऐसे ही होता है, वही आई टेस्ट होता है. No, but there are other techniques also for seeing a small child. First eye examination has to do from between 6 to 12 months of age. And second is 2 to 3 years of age, 4 to 5 years, and after 6 years every year. Because child is developing their visual skills very fast. And what does an eye examination should include? This we all should know. Vision is not only about the visual acuity, reading black letters on white background. No? Vision is about much more than that. So the color vision has to be checked of a child. So if there is any color vision deficiencies or color vision defects, the child can be guided for selecting their field, their career in that manner. There might be eye movement disorders. What is the persistence indicates whenever we are seeing scanning things. So if I am seeing from sir to man, and if you also try to do that, probably when I am seeing in the fraction, my eyes have moved to this, but I don't remember anything in the middle. I'll just see him and I'll see him, see her. So that is what, this is the fast movement. So the accuracy of eye movements is also very important for the cognition, for the navigation, for a lot of other things. And you have divergences. So again, when we are doing the exact activity, you see, look at my eyes, they come together. They go straight together. So when these two eyes work at tandem, in coordination, so these are checked by divergences. Then we have stereopsis or depth perception, the 3D vision, everything we see in 3-dimensional world. Okay, sometimes the child is not able to complain because they are having problem in one eye. So we'll just do another small activity, more on the present. So what we try to do, okay, we'll just try to close our one eye like this, and we'll keep 2 fingers like this. Do it. Okay, and now you have to touch the tip of your fingers. Do it fast. You have to close only one eye, not both eyes. Okay, now open both your eyes, and now do it. Which is easier? So when we are doing with one eye, sometimes the finger goes like this. It's not touching correctly at the particular position. What does this indicate? That we require equal functioning, proper functioning of both the eyes to have accuracy or that amount of visual efficiency. And that can be measured, which has to be measured. And it has to be normal as per the age. And vision is also about the eye-hand-feet coordination. Because vision is the first sensation which develops in a child. So all other sensations, they develop, they become stronger over the period of time. But vision is one sensation through which all other senses, they develop very fast. And that is the reason why child try to grab everything, touch and feel. Then only they realize, oh, what is hot, what is cold, what is sharp, what is blunt. All these understandings happen in that.
So doctor, before we move ahead, I would like to ask the mothers out here. Like I just saw this eye examination, which is I think 10 steps of an eye examination. How many of you were aware about that? Any questions over there? Is that understood? Any question you would like to put up over there, because then we can move ahead. Yeah.
I remember one of my students, he had this tendency, it's not right, talking with somebody or reading or just, watching some screen or something, he kept doing this.
Frequent blinkings.
Yes, and now he is growing up, so he is very conscious. In fact, he started getting feedback from his friends and teachers and social relatives and everybody.
Right.
Their parents are aware that the child has this issue. Probably they are associating this thing with the anxiety. The moment he has an examination or maybe something, then it increases. But the sad part is that, like what I came to know now, the parents are not taking him for the social gathering just because of to expose this thing. I mean, the people will come and ask that what is wrong with him, what is happening. So this is what happening. So I asked them to go for the thorough checkup. But I don't know, I mean, as a teacher, how can I help? I mean, what should I advise them?
Right. That is the reason why we are discussing here all these steps. So we have to be aware. Okay, so now the eye examination we all know is not just reading black letters on white background. That is not the eye examination at all. That is just checking a vision or probably a visual acuity. But how does the child process it? There are 3 important steps. Child sees what is there, then child is able to correlate what is it and able to process it into a meaningful manner. These are different things. These are different steps.
I am waiting for the, as I said, I took my daughter for an eye test like every year, but whatever eye test procedure was there for the adults, the same for the children.
Yes.
So it made no difference. So we don't know that for a child for the tests.
Yes, that's why thanks to Sonika ma'am and Nandi ma'am for having this workshop, so that we all can understand.
But then how can we analyze?
Yeah, we'll come to that. We'll come to that.
Like I said, I asked mentioned
6 months. Yes.
Finance, then money. She knows
Yes.
medical and she's finding it.
So do we, again, same question. So do we wait for a car to break down for a service, or we get it serviced regularly so that it doesn't break down?
But you know, like in family, suppose if I ask this question, my one will say, "Kya problem hai?"
Probably they're not aware that way. So you can use such simple examples like the one I am telling you. It is very important. And not only eye examination, even dental examinations and other also. When a child is born, they are given a card. These things have to be done at this certain age.
And like you know, we can't judge kids and this. So I want to give my example. What I do is my daughter. We show her a cat or a cow.
Right.
How far the animal is from the cage, he will point out.
Okay.
My son, if he's not interested and he's interested in cars, no car is there and monkey is there, he don't want to watch the monkey, he will not want, but he will point to the car.
Right.
So we are telling that is monkey, like, we don't want to see, we will see the car. Thus, it makes like, does it relate to vision or it's just
See, it can
we
be.
can judge them.
You cannot judge that, and that is the reason why we are there to judge that for you. Because, but everything, in anything of doubt, it's better to have a thorough examination and consultation. What will happen? What will happen maximum? We will say that, okay, your car is working in a perfect condition. Or what else will happen? Car iska engine oil thoda sa upgrade kar dete hain. It needs certain alignment. So that is what we do. So there is no taboo in that. So now coming to the common problems which come in the children, and not only at early age, at any age it can happen. The first and foremost thing is the refractive errors. What are refractive errors? बच्चों को चश्मा लगना. तो जब हम छोटे थे तो we used to see that बच्चों को चश्मा लगता है तब अगर उनके पेरेंट्स को भी चश्मा है. And it is no more that case. There are parents who don't have any glasses, but the kids end up having very high powers. And we are seeing that in a very common way. There is a recent research which says that by year 2050, दुनिया की आधी population, the half population of the world would be myopic. Myopia is nearsightedness. दूर का माइनस चश्मा लगाना पड़ता है मोटा और दुनिया की आधी population myopic हो चुकी होगी. Because the rate of increasing of refractive errors is huge. So we'll also talk about that and how we can control that. Now, there are problems of lazy eye, amblyopia. What has happened? The child will not complain. The one eye is not functioning well. The other is seeing fine. So we are not able to pick up that effect. But how can you pick up that effect? Only if there is an eye examination. Then only a doctor will tell you that okay, one eye is working at its 100% efficiency, but the other eye is working at only 50% efficiency or 70% efficiency. And we need to do certain things, probably eye exercises or classes, to make it equal and balanced. For again, the proper development and for having the efficiency of vision.
Yeah, my mama's son, he was actually 4 to 5 years of age at that time. And they were just playing the game, and he said that just close one eye and then tell me how many fingers are there.
Yeah.
Then he said, let's close another eye. And he said, I can't see. I said, what are you talking?
Yeah.
He said, actually I can't see. And then they just got the tickets done the same day, and they came to Delhi to us. And then he actually had no vision on that eye.
Okay.
So then he was treated for around 12 years, and gradually the vision came. He had to keep his one eye closed for around 20 days and then another eye closed.
Just like this.
Yeah.
So this is what is lazy eye.
Whole schooling went like this.
Yeah, so this is what is lazy eye and amblyopia.
And today he is the eye again.
And
Very well.
that is very good. That is very good.
See early detections.
So early detection is very important. There are a lot of young adults who come to us and they don't realize it. Even in their 20s also they are not able to realize that one eye is not working well. So it comes to them as a shock. And this is a very old technique, about 200 years old technique. As per recent scientific studies, this is not to be used. Because there are other methods to treat amblyopia of these eyes. So that there are squinting problems that we see. You see, one eye is moving abnormally inside, outside. It can happen constantly or it can happen manifest at certain times. जब बच्चा पढ़ रहा है, थक गया है, तब उसकी एक आंख बाहर चली गई है अंदर. We need to notice that. There are voices disorders. This is something which you can also notice probably. If the child is watching a mobile phone and you see only one eye is focusing on the mobile and the other eye is gone out. Oh, there is certain problem. Both eyes are not working together. Poor eye-hand coordination. This you can notice when they are playing. You're asking them to catch something and they are finding it really difficult and hard. And this is very common these days. And this is because of overuse of digital devices. There is dancing eye movement. Certain kids have very, fine vibration in the eyes. So that is something which is called as nystagmus. So this is also something which is a common problem. Now what can happen in correction? Correction can happen through glasses. There might be some certain filters can be given. Like somebody was telling that the child goes out in the sun, the eyes become red. So they might be having photosensitivity, or they might be having, they will be sensitive to UV radiations, and they need a proper filter for that. You also use sunscreen. So same way, our eyes also need sunscreen at times if there is a lot of sensitivity. Might be needing some prism, some vision therapy, some low vision aids. They might be just needing certain training. And most of the cases this happens, this helps, especially in the focusing issues cases, contact making, contact lenses. That is where the vision therapy comes in. People are not aware about vision therapy. So what has happened through vision therapy? So we give all these forms and many more forms of eye exercises. And we try to work on the other parameters. Because glasses works only on one parameter, that is visual acuity. But when we talk about the accuracy of vision therapy is the solution. So this is how it is done using softwares and other things also. So it improves the visual comfort, ease and efficiency. So there are a lot of people, even young adults also, their vision is normal. They have only 0.25 or something chashma. They also don't understand. People chashma to de diya. I'm not very comfortable with this also, but I'm wearing it. But still, I'm not comfortable. I'm getting headaches. Not able to focus. Not able to see screen for long hours. So they are having other issues which have to be worked upon differently.
Does vision therapy help with the visual power?
Yes. Yes, it does. Because most of the times that little power is just given because the examiner is also confused and the patient is also confused. Symptoms तो इतने सारे हैं, number कुछ नहीं आ रहा, थोड़ा सा तो दे ही देते हैं. And by general, as an eye doctor, I can tell you, if I screen everybody here, all of you will have some amount of power, but it might not be required for everyone. देखिए हमारी आँख के अंदर भी एक लेंस होता है, तो which works that way. So this is how it is. So if you really want to understand, and if we have time, I don't know, ma'am allowed, we can also cover what is vision, how the vision is formed, and various milestones.
Yes, I think a very important question that I come across as an educationist, and you all as parents can at this point, put across certain questions, because when these slides were coming up, 2-3 questions came in my mind. I think in one of the slide you had mentioned about the filter, like that blue lens, and some of the parents ask us that, ma'am, anyways, there are certain classes being held online. मेरा बच्चा तो yoga भी online करता है, like this is a trend, and so is this going to help? We do not even know the correct answer to guide parents about it. So I think you can tell us, if we hear this so much, I personally do, about these blue filters that can actually कि ये
computer classes overly advertise on Instagram and other things. They show a torchlight which says the light is passing, light is not passing. So see, there has to be everything should have a logic. It's not like that blindly everything has to be followed. We all have grown up without blue filter glasses into perfectly normal individuals, and that will keep on happening. It is not required for everybody. So first thing and foremost, who needs those computer classes as a prevention? Only if a child has a consistent digital device use of more than 4 hours. So if your child is just seeing a mobile phone for half an hour, 45 minutes, sorry, you don't need to put him in unnecessary classes. That is not required. The next question comes, what kind of classes? On online, each and everything is coming. So when we buy classes, so we fail to ask certain questions of quality standards at times. So what we should ask, whether those lenses which we are buying, are they FDA approved? Because unfortunately, as of now in India, there is no standard. So if you are buying from some standard brands, what is the difference? You get lenses at a very cheaper cost also, and there are lenses which are very expensive also. So it's not just the difference of something. There has to be certain standards, quality standards which has to be made. आप लोग बचपन में एक experiment करते थे, शायद मैंने तो किया, I don't know about you guys, but we used to see that magnifying glass, we keep it on paper, and we used to put it at sun rays, and it used to catch fire. Remember that? So even those kind of materials are there in the market, unfortunately, which can even cause harm to the retina, which can burn the retina also. And sometimes, just to save the cost, or probably we are not aware, we choose those options. So next time when you go, you can ask whether this lens I am buying is FDA approved or not. Does it meet the quality standard? Where it is approved from? So these things are which is important. So.
And before we move to developmental milestones, I don't know if anybody of you also have come across these issues where we have come across where kids are very confused between, like you mentioned, the directionality, and the teachers struggle with that a lot because teachers are also not trained in to overcome directionality. Parents feel that teachers can do a miracle कि वो P और D एक जैसा बनाता है, confuse P और Q एक जैसा बना रहा है, exercise में हम क्या बोल रहे हैं वो left की जगह right कर रहा है. And of course the teachers are not trained into handling this because this is something which I think I understand now is more related to their vision training and visual and muscle training than what we can because these cannot be, I think, treated by force. We cannot be keep telling them कि नहीं तुम गलत लिख रहे हो and you keep correcting. It doesn't work like that. So for that, how does this vision therapy actually work for these kids?
See, all of us watched that movie Tare Zameen Pe, and thanks to that movie, it brought such a big topic in the mainstream in such a nice manner because that problem was existing all the time. Even we had it. Even there were a lot of our brothers and sisters who were struggling, or probably we also as kids, and we never used to understand what it is. Einstein was thrown out of school because he was dyslexic. People were not able to understand how he is able to perceive what he is doing, and his mother did wonders for him, and he was a very intelligent kid. So such children are very intelligent, their IQ levels are much higher. And there was a study which was done who have such issues, but they need right channelizing. And they probably need different way of teaching them, understanding them. Their perspective has to be understood. And they have to give it this feeling. And why does this happen? Can anybody tell me? Have you noticed of late जो बच्चे COVID time में हुए हैं, they develop speech very late. Do you think a lot of such kids, you feel that they are not like those earlier children which were born before COVID? Have you somewhere noticed that? Do you think that mothers' use of mobile phones also hamper the fetus, the child who is in the world? It is scientifically proven fact. And ample number of researchers to show that when the mother is overusing the mobile phones during her pregnancy, the child tends to become, high on anxiety. They have high attention deficit disorders. They have poor speech, delayed development, even if they are seeing the mobile phones. You know how we learn to speak? How do we learn to speak? Through our ears or through our eyes? Simple question. We learn to speak through our eyes or through our ears? Ears? It's primarily eyes. So that is the reason why children who are born blind, they have difficult, their ear structures are perfectly normal. But they cannot understand what people are speaking. We need special training for that. And that takes a lot of time for them to grasp, okay, this is speech. Okay, this is how it is perceived. There are special techniques. हमने जैसे ब्लैक मूवी में देखा था उसके हाथ में तो other senses we try to develop that. Akshita would know it. So how the child sees to speak, to seeing the lip movement, to see the expressions. And what these mobile phones are doing, lesser interaction. बच्चों की visual memory बहुत कम हो गई है. They are not able to recognize faces even of relatives. And there is a huge speech delay because there is no social engagement which is happening of children. And that is how they learn to speak. This is a basic tip which we all can remember. So I think probably I have answered your question.
Yes. Any other question related to? We are at 4:12 right now. We have another 10 minutes to wrap up the presentation. I would really like to have a look at the developmental milestones. If any of the mothers who are interested, you can tell me.
Yeah, only if you are interested.
Yeah, because I think because हम सबको ये समझ नहीं आता है कि किस एज पे देखना क्या है. You know what you need to see in a 2-year-old maybe differs from what you need to see in a 3-year-old. और हम same dimension से देख रहे होते हैं. So I think for us to even know and understand कि वो dimension क्या है is very important. So if we could quickly move to that, I think Ms. Nandini had a question.
Like, this is about the children.
Right.
So my question is, I know someone who secured 100 of 100 in maths in 10th
Great.
and 12th.
Wonderful.
But later on with the pressure of society and more pressure, I find that I find it that now when I read numbers, when I'm reading it as if it is 3, 6, 8, 7, 9, I will sometimes read it 3, 6, 7, 9, 8.
Okay.
Is it like, I don't know, I'm not concentrating on that or what can be the reason. But yes, now I'm not interested also in that maths and numbers because I'm into the accountancy field. I have all, so everything was fine, but after marriage, I'm like, I don't want to do, or I don't know why it is happening, but I read the numbers sometimes. Can it happen later on also?
Yes.
Or it is just because of the mental
First of all, we should
stress?
give a big round of applause to her because it takes courage to put up your thing that okay, I'm not experienced that.
Yeah.
And I'm glad you brought up that question. So, you know, what is the recent researches which are showing us? कि जो बच्चे साउथ ईस्ट एशिया में हैं, countries like China, countries like Korea, countries like India, यहाँ पे refractive errors की rate and myopia and other refractive errors progression, eye power increase is very fast, very huge. And these researchers have also, you know, scientifically found out now that in सबके अंदर बहुत सारा जो role है, that is of the pressure also that we put on our child. So इंडिया में पढ़ाई हमारे ज़माने में तो डंडे के जोर पे हुई. आज के ज़माने में थोड़ा चेंज हो रहा है, हमें ऐसा लग रहा है, but it is not that. I know of children, they go to school till 2 to 30 and after that they have probably 3 hours of tuition and then they give about 3 to 4 hours of self-study. And this is the girl which I have recently come into my clinic and she is in the 7th standard. And she is having serious headaches. Now she is put on therapies, on what not therapies and diagnosis and things. Because she is having that sort of a pressure. So it's not only that the power can develop with the pressure, but also your other visual skills, your visual efficiency can be affected. Because हमारा brain है ना, हमारे brain का 50% part is involved with vision in some manner or the other. 50%. There is no other organ which has been given that much of space in our brain. Our brain is supposed to be the mastermind of everything. Brain dead person is dead. किसी का heart टूट गया, you can do a heart transplant and you can revive the person, but not the brain. So even your heart, even your other organs, they don't occupy that amount of space. So stop giving that pressure That pressure should not be there. It has to be engaging. Even the therapies, even if it is required, has to be in a fun way, in a fun manner. Child should not be labelled and we are here not it. And child will learn very fast. There is also research which I recently came across and it shows कि जो parents में ज़्यादा लड़ाई होती है, उनके parents, उनके जो बच्चे हैं, they have screen addiction a lot. और जिन बच्चों में स्क्रीन टाइम बहुत ज्यादा है, स्पेशली खाते समय, हम लोग आज के डेट में मदर्स क्या कहते हैं, खा ले, ये तो मोबाइल पकड़ आगे स्क्रीन पे चलाते बच्चे ने खा लिया. तो व्हाट इज दैट हैपनिंग, वो अभी नहीं आपको दिखेगा. बाय द टाइम दे कम इन दैट टीनेज, इट इज बीन प्रूवन बाय लॉन्ग टर्म स्टडीज कि उन बच्चों के अंदर देयर इज एंजाइटी, सिवियर फॉर्म ऑफ एंजाइटी, erratic behavior, and they don't even think once before taking unusual steps in life, harming themselves or probably harming others. So these things are like
because phone is only bad for us. But after that, now it is very difficult with all this jogging and all. Just the phone usage is very high. उसके कारण भी stress and pressure आता है. And then baby led weaning. That will teach you how not to let kids eat along with the screen. That works every day. You are together. You together eat along.
अच्छा, you tell me, you brought a good question. अब क्या हमारे बच्चे पैदा ऐसे हुए थे कि स्क्रीन देख के खाना खाते थे, या हमने वो आदत डाली? We introduced that, right? So as parents, it's our responsibility. And बच्चे वही, आप भी अगर टीवी देख करके खाना खाते हो, so that is a normal behavior for a child. And the amount of logics you give them, it will not work for them. उनके लिए क्यूरोसिटी डेवलप हो जाएगी, वो आपके सामने नहीं करेंगे, आपके पीछे से ज्यादा करेंगे. That happens.
अदर मॉम जिनके टीवी देखते हैं उनको अगर हमने कुछ बोल दिया तो वो बोलेंगे देखते देखते बच्चे क्या करते हैं. तो टीच ना नहीं करना है तो हमें और बच्चे देखते तुम्हारे बच्चे.
Yeah. So even if they see also, see, I am not against. ये बच्चे देखे ही नहीं ऑनलाइन कंटेंट. There are wonderful contents also, and people, there are kids who learn very fast from that. There are a lot of interesting cartoons and series. I remember one thing which was mentioned in a scientific study. That's how I came to know about it. It's not that I watch it. It's called Dora. And it was seen that people or children who watch Dora, their vocabulary is fab. It's amazing what vocabulary that they develop. And they have great speech. And we don't know that. So even content can be helpful. But we should be able to monitor what kind of content they are watching. And we should be sitting with them. And they should be co-viewing of the content. Yes.
We can use Alexa. I believe that if you listen better, you will learn better.
Yes.
Vision is exactly important. Meditation instead of giving them TV or mobile screen time, it's better to give them Alexa. Put something in it and then
Yeah, definitely.
Yeah, this is also very true. But our kids were 6 months, I got them Alexa on TV and mobile पे डाली है, and now they know sounds of animals since they were 10 or 11.
आपका विजन भी बचा रहेगा और आपका मेमोरी जो है लिसनिंग से जो मेमोरी इंक्रीज होती है दैट वर्क्स ऑसम. सो एलेक्सा इज मच बेटर देन टीवी मोबाइल और समथिंग एल्स.
See, it has to be a combination of balanced approach. So that is what we should understand. तो पहले के जमाने में क्या होता था या अभी क्या होता है, when your child is going around in a restaurant, they're exploring everything. There is a touch also. So there is a sensation of touch. There is a sensation of sound. There is a sensation of vision. So the child learns to correlate all these things. अभी क्या हो रहा है with overstimulation of vision, they're able to see, but they're not able to process. What am I listening? They not remember. They will not remember. memory is not that sharp. But it's not required, na? Every day the content is new. So why should I remember and watch the same movie again and again? And daily I have the same content. They forget. They have very poor eye-hand coordination also. So that is the reason why when I told it has to be work in collaboration. Only sound, no visual stimulus will also not work. Only visual stimulus, no sound will also not work. You give vision and sound, but no touch. So then that is the reason why we have this concept of preschools who are specialized for gross motor skills, developing and all that. So this is very important. And there are certain reflexes through which a child is born, and they should go away as the child is born. And it doesn't happen when this normal development, all together 360 development doesn't happen. Again, we've already taken so much of time, and people would be tired. Okay, see, because you have to stop me. एक ऐसा topic है, I can do marathon. I might not even stop also. I have so much of content around it. So are we really interested to go ahead?
Yes.
So we just basically try to understand. Okay? तो vision. सबसे पहले हम बात करते हैं vision. जो हम देखते हैं वो हमारी आई में बनता है या हमारे ब्रेन में बनता है. तो सबसे बेसिक चीज जो भी हम देखते हैं वो हमारे आई में नहीं बनता है, हमारे ब्रेन में बनता है, which is here, the visual cortex. And there is an entire process, and that is the reason why I tell for vision is involved. 50% of the brain is involved for vision. Now, key milestones which we must remember when a child is born. They should blink in response to the bright lights. This is an important milestone. They don't have vision, they will not blink. If you show them bright light, they will blink. Uncoordinated eye movements may appear, they may appear cross-eyed, but this is perfectly normal for a newborn child. Because they don't know how to use the two eyes in coordination. That happens with over a period of time. There is no color vision when a child is born. So there is everything which is black and white or in grey scale. Ability to stare at the objects of only 8 to 10 centimeters away. That is the reason why child remembers only mother initially. And then धीरे जैसे वो बड़ा होता है, and they are not able to hold focus. जैसे जैसे बड़ा होता है, they try to recognize the dad, the immediate family members, but he is not able to recognize the people who are there in the distance. When the child becomes 1 to 2 months old, the vision expands 10 to 12 inches away. They can stare at the faces, black and white images, follows the object up to 90 degrees. What is that? Up to 90 degrees they can try to follow. Suppose that they not follow, उनका head gaze change हो जाएगा. They watch the film. जो छोटे बच्चे हम क्या करते हैं? How do we check whether they are following the line? Are they able to follow the objects or not? These are the milestones. Same thing for 2 to 3 months. Again, the vision expands a little further. They start seeing their own hands. You will notice children, उनके हाथ अब मुंह पे जाने लगते हैं. They will try to see, उनका हाथ मुंह में आता है. They try to grasp a finger or whatever. They try to explore what is it, instrument. Then at 4 to 5 months of age, they begin to reach for the objects. So what we should be doing? We should be giving them such toys. For them, they have to reach. It is very important to develop their gross motor skills. They are learning what they are seeing. They are learning to use this apparatus called body in relation to it. So that is the reason why the child can recognize the bigger objects. You have to give them bigger toys, not the smaller objects. They will not be able to recognize. The color vision starts developing. So that is the reason why your child is very attracted by the bright colors. But if you give them pastel colors or dull colors, the child is not attracted. Because that is not developed. When a child is having 5 to 7 months, they develop full color vision. They have the ability to see the image and objects up to a few feet away. Now they start to hold focus. वो देखेंगे थोड़ी देर, and then they will turn away. This is not. 7 to 12 months of age, they learn They learn if something is coming towards me, something is going away from me. So now what are the activities you can do at this age when they're crawling? You can just roll a ball to them. So when you're rolling a ball and you can ask them to roll a ball, not be doing, but they will explore. They will able to understand what is coming towards me, what is going away from me. So the spatial vision, what we call is, it develops. At about 1 to 1.5 years of age, they have a clear distance vision. So they should be able to see clearly in the distance. Their depth perception starts developing. So the refinement in eye movements happen, the accurate eye movement should be there. They recognize the faces of the familiar objects. They remember, they recall, watch and interact with interesting items, new people. They're very curious at this age. Up to 2 years of age, anything new they will see, they will just go out there and they want to explore it. They want to know them, they want to meet new people. At about, again, the clear vision develops. They start staring at objects. At about 2 to 3 years of age, there is an improvement in their close vision skills. When a child is small, why we say to a child less than 2 years, don't give them mobile phones because they hold it very close. And it is a very, very, very tough process for a brain, for eyes to have that. So you have to give them all the games or the things which they can do for distance, because that is the vision has to develop first. And then after 2 years of age, slowly the accurate near vision develops. Schools of when a child is small, you give them bigger markers, you give them bigger text. बच्चों के textbooks देखें, they have bigger fonts in that. The toys में bigger sizes are there. They don't want them to over focalize. And what is happening through mobile phones? Over focalization. So now when they are at the preschool age, they should have a perfect normal vision. Clear and single vision up to few inches from face to distance, development of gross motor coordination, recognizes complex visual shapes and letters, identifies colors. In the school age, 48 marks to 72 marks, he knows letters and some words, recognize orientation of letters, begins reading, possesses mature sense of depth perception, accuracy. You give them weaving activities and all those things, the accuracy becomes better. So this is how the vision is not basically, you see chair by chair. It is a learned skill, like hearing, like walking, like talking. So vision is also a learned skill. So let your child explore it through the natural things. That is all I have for you right now. For more things, you can stay connected with me. I'm also a YouTuber, and it is my interest to produce a lot of informative content. So if you are interested, you can go through that. So good number of subscribers and good numbers of views also, a lot of parent inquiries which also come through that. So if there are any specific topics, you might find answer there. Thank you.
Thank you so much. Can we all give a big round of applause to Dr. Abhinav Maharwal. So I think from the entire team of Little Millenium, we are really honored to have Dr. Abhinav Maharwal. Can we have a small memento from the team of Little Millenium? I want my mother.
So before that, Sonika, I just recollected, there was a question which was asked by the man before starting the session. And she said that you have a 10-year-old son who is already in classes and you are worried that the power increases very frequently. And that is the reason why you actually came for this workshop also. So let me answer you that. There are specialized lenses also which are available these days for myopia control and other refractive error control, which is given in the optometry clinics for that purpose, where the power increase can be controlled to at least 60 to 70%. So we can help children not going to very high significant powers.
Thank you so much. Any other question? No question should remain unanswered. Any mother who has... Okay, you'll be seeing that later. Any other question in anybody's mind related to...
One question is like you were saying that the young mothers, they do mistakes. Now it's already done. And which is done, we can't undo that. But yeah, the consequences will be there probably when the child grows, maybe a teenage or something. Is there any precautions? Whatever is done is done. So how can we take care of what are the other precautions or other things we can do now? So if imagine if there is any harm or anything has done, so हम उसे change कर सकें.
Yeah, it is. See, our brain is very plastic. When we say about plastic, it adapts at any age. So, जब तक हम पैदा होते हैं, तब तक हम बढ़ते हैं. The brain keeps on growing. It constantly makes neural connections. So when I said in that slide that vision is a learned skill. When it is a learned skill, it can be learned at any age. Things which we can do to undo what wrong has happened is we can create curiosity outdoor exposure. So if you have children below 15 years of age, there has to be a minimum outdoor exposure of 4 hours. So are we giving that? Unfortunately, the classrooms these days, nothing against those educationalists are doing a fab job, but everything is happening in a 20 by 10 room. There is no exposure either in the morning or in the evening. So that is not there. You got to encourage that. You got to involve your child into that. A child is unnecessarily put into tuitions. There again, they are sitting in a closed room environment. And what I mentioned, the child has to have developed first fully his or her distance vision. They should learn to use their vision for distance. And how can you do that? Give them an outdoor exposure. Indulge them into outdoor sports. Best form. They will be excited. Fast-paced sports, other curious activities, you can do that. You can go on treks. You can go on picnics. हम छोटे थे picnics पे जाते थे अपने parents के साथ में. But now you go to restaurants. We used to cook food from the house and used to have that food in the natural open environment. That's gone now. But who can change it? We can change it. And that will solve most of the problems. Because most of the problems that we see today are acquired problems. And they can be easily be reversed with the right approach.
So, जितना इसी को learn करते हैं उतना इसी को unlearn भी कर सकते हैं सिर्फ distraction required.
Yes, exactly.
Right approach on right time. So that's what I concern that what should be the approach and what time. Imagine if I do the same thing probably later age, it will not be.
Yes. See, how it was important. अभी आपसे कोई पूछता है कि आप CA बन गए, मान लो you just talked about CA. Why you didn't introduce कि मेरे 8th में इतने percentage marks आए थे, फिर 9th में इतने, 10th में इतने, 11th में इतने, 12th में इतने? Does anybody ask you that? No. Why we have to create a pressure around it? And second important factor is diet. We all know that a child should have a healthy diet, and we are ready to buy supplements to our child, for our child, and we'll give them vitamin A supplement, vitamin B supplement, D, X, Y, Z तक के supplements हम खरीद लेते हैं, बच्चों को दे देते हैं. Which is not required, which are very harmful. Until unless the child doesn't have a specific deficiency for a specific vitamin, there should not be any supplement which should be given. You are killing their natural process of digestion and absorbing nutrients from food. Just give them healthy food. That is enough.
Join like real football, like this is not football, and which according to him was. So yes, I think we all get signs, we all get signals. I think हमारे बच्चे ही हमको वो signal देते हैं उस point का, where things are where the usage to over usage is happening. And the only thing we can always do is take actions, जो बहुत easy होते हैं. ये actions लेने बहुत easy हैं, just we get them outdoors and we make them do it. So I think we all got to be just taking those actions which we all know, right? And yes, of course, being aware, not over testing them, not over kind of being worried about it. Any other question that remains unanswered?
Yeah, from
Is there something called overreading? My daughter reads for 5 to 6 hours a day, not padhai, story books, encyclopedias, whatever it is. She gets almost 2 to 2.5 hours outdoor time, which I'm going to increase now.
Yes.
But जैसे over screen time से तो आंखें खराब, overreading से होती है क्या?
देखो, over reading और over screen time इनसे भी आगे खराब. It is about how you use the technology, how you use the things. So as I told in the session earlier, the closer the things are, it is going to create problems. So if she is interested in what her age she's 7.5. Don't give her very fine prints. The font size, the font size should be bigger. It should be bigger than what we are used to reading, and the distance has to be good, at least 1 arm distance. Yeah, so they're going like this and reading, adopting a normal head posture, they're lying down on a bed and then reading. It is not good. If they're sitting and then reading with the appropriate distance at correct eye level, it is good.
So like when we go out for holidays or to a beach place or anywhere, we usually buy glasses, sunglasses, and we check that if it is UV rays protected, then so it's not harmful to eyes, etc., etc. For our children, do we need to take such care, or it's good to be under the absolute nature and hope it doesn't increase their red eye? So what is it? Should we take a care, or should we let them be?
A very, very important and a very good question. So we tend to see, in India, we see sunglasses as a fashion accessory. But it is not. If you go to Europe or you go to other developed countries like how we call it, where people are more aware, they use sunglasses as a preventive device. So do you think हम जितना धूप में रह सकते हैं उतना हमारे बच्चे रह पाते हैं क्या? Skin is very soft, it's very tender, everything when they're born, even their head is not developed fully. How do you expect their eyes to cope up to all that we are giving them? So definitely it creates problem, and that is the reason why people develop in their teenagers and early 20s and 30s. And I'm sure a lot of you who sitting here also, we tend to develop dry eyes at such an early age. Now we listen that cataract developed at about in India 35 साल के आदमी को भी cataract मिल जाता है, 40 साल के आदमी को भी cataract मिल जाता है. But if you see the normal average age of cataract in Europe or in other developed countries, it's about 75 years of age. That is that age when they get cataracts. So it is harmful. We should use good quality sunglasses, and good quality sunglasses need not be expensive. As I told initially in the session, हर sunglass के ऊपर कुछ certifications लिखे होते हैं जो brands लेने पड़ते हैं. They have to be CE certified. They have to be at certain standards to be available in certain markets. So try to use those products for your child also. And for them it is most important. It's more important than you.
Thank you.
Thank you so much for that amazing question. Any other question in any mom's head? It is a closed space. It is a very safe space that you are in. Any question related to you or to your baby, anything which comes to your mind ever related to vision, digital devices, that has remained unanswered.
Last question is one of my students, while taking him outside for sports and play period, or even climbing stairs, he used to climb one step together, So I noticed this thing and I understood that there is some, ideally he should run or he should climb or he should walk like a normal age, the other children. But I didn't understand whether it was a depth perception issue or gross motor issue or eye-hand coordination issue or something. There was something wrong, but what was that? I don't know. So even I was not able to, advise parents that you must visit this and this person or doctor to just rule out what is the issue. What should I do with this?
See, that is the issue, and most of the teachers actually, they notice all these minor things because they can easily compare the performance of a child compared to the other children, which as parents sometimes we are not able to do it. So this child will definitely have a depth perception issue, which we also call as stereopsis, and he is not able to perceive depth, and that is the reason why they are more careful in terms of climbing instead of running, which the child should be doing that ideally. He is not able to do it. So there can be a problem with depth perception issues, which could be because of amblyopia also, or could be because of the perception also, or could be because the vision is normal but the eye-hand coordination is not normal. So again, in all those cases, the thorough or proper eye examination a holistic eye examination has to be done, not just the vision test.
So thank you so much. We are extremely happy, and we thank all the parents and all the mothers who made it today. That just shows how informed you are and how informed you want to be. And that is the first step towards anything, right? This 1 hour, I think we could really add some value to our kids' life here on, and that's what the entire purpose is. To be better educators, to be better mothers, to be more informed, and to be taking logical steps towards it. So I would like to invite my mother, who is also my partner in my school, to please give a small memento from the entire team of Little Millenium to Dr. Abhinav Maharwal for sparing his valuable time and insights with all of us.
Thank you.
Thank you so much. It was really informative, really meaningful. And I think we all had a great time. Thank you. Thank you. I would also like to invite Miss Nandini from FBS.
It was really a very nice vision, interactive and learning. I never knew that vision can be much more about that black and white thing.
Thank you so much. I request each one of you to please have a high tea. We always invite all of you on a high tea. And let's all have tea together, and there could be some interactions over tea always. Chai pe charcha honi ho sakti hai. So yes, and I would like to invite Dr. Rajapark also. I think she wants to say something.
First of all, thank you so much for calling us here. Because जब मैं अपने सभी लोगों को यहाँ लेकर आई हूँ, I feel that yes, my mother learned many things. So thank you so much. Personally मैं मेरे लिए एक बात कहना चाहूँगी, क्योंकि मैं स्टार्ट किया था सर को दिखाना. मेरी बेटी को जब पैदा हुई थी तो छोटा सा न्यूमोटोमा था, इट्स वेरी नॉर्मल. बट डॉक्टर का कंसर्न था कि आपको आई विजन को दिखाना है. अगर मैंने उसको दिखाया था 6 months की थी वो, एंड ही सेड इट्स एब्सोल्युटली नॉर्मल, कोई इशू नहीं है. और उस वक्त भी उन्होंने उसका टेस्ट किया था. तो वन ऑफ योर मदर, आई डोंट नो कौन थे, जिन्होंने पूछा था कि इतनी अर्ली एज में वो नॉर्मल वे में टेस्ट करते हैं. सो ही नोज. फर्स्ट ऑफ ऑल, दिस इज वेरी मच इम्पॉर्टेंट टू whom you are going and what they knows. So he is one of the person in Jaipur right now to whom I can send my children very nicely, because I know he is a pediatric therapist, vision therapist who work very well. I'm a pediatric therapist. I know क्योंकि मेरे पास में थोड़े टाइम पहले एक बच्चा आया था. सर, उसको डॉक्टर ने ADHD मार्क किया, 2 डॉक्टर्स ने उसको ऑटिस्टिक मार्क किया. एंड आप मेरे पास में जो बच्चा था उस लिटिल कंफ्यूज्ड, बिकॉज इतनी अर्ली एज में मेरे उस टर्म्स में नहीं होता कि आप ADHD या ऑटिज्म लिखते हैं. सो आई सेड देयर इज समथिंग फिशी. आई डोंट नो व्हाट इट इज, बट यू हैव टू गो समवेयर एल्स. Then the parents went to the mobile somewhere doctors, and they got to know that it is only vision issue. So vision issue बहुत major होता है, उसको समझना early age में it's very important. So I request you everyone, at least जब तक आपका बच्चा 5 साल का proper नहीं होता, every year you have to do. Not only vision, every other case of test, whatever doctors tell you, you have to do. I did it, so I can say I did it. Okay, thank you. Thank you so much for calling us here. Thank you.
Thank you so much, Dr. Lakshman. A big round of applause for you also, because it's a wonderful work we're doing with so many kids who need guidance and that kind of support, which they are not getting from so many other centers that I know. So we welcome you all to the high tea now, and we hope you all had a very good time. And do please share your video feedbacks with our team members over here. That is really valuable to us. That's what we thrive for. So thank you so much. Thank you, everybody.
Workshop is very wonderful. We know so many things not only regarding a vision, yes, development and the milestones and the other things related to the doctor and the mothers. I think there is lots of confusion regarding vision. So we were just thinking that people and children are not able to do so many things, that is due to so many other things, but that is the vision also. Yes. Thank you so much for the wonderful one.
It was a much-needed workshop for us, for parents. We parents are facing this problem since a long time, and thanks to ma'am and the school facility to provide us with this workshop. We really learned so much today, and we are going to actually undo the things we are doing with our kids these days, and what we have learned, we are going to play that with our kids. I'm glad that the school is having more screen time for the kids, and our students are learning, our kids are learning so much here.
Hi Dad, this is Millenium. Thank you so much for having me here. It was an amazing and literally eye-opening session for me. I have noted down all the tips and tricks given by Dr. Abhinav Maharwal, and I am going to make sure that I do the preventive vision, care tips and tricks with my daughter.
Hi there. Thank you, little Millennium, for arranging such an amazing session which was on vision, and I learned so much tips and tricks for my child which I'm going to use. And something that I learned today was that every child should have 4 hours of outside exposure, which we are currently not giving, and that is like an amazing tip which I am going to practice with my child, and she'll be overjoyed to have it because she loves to play. And once again, I thank you for arranging such an insightful and wonderful session, and thank you so much.
It was such a wonderful initiative by Little Millennium to call all the mothers for something which we were totally not aware of. We really get blinded by whatever we read on Google and whatever is available on Instagram, ads and everything. But as Mr. Maharwal, Dr. Maharwal pointed out, that instead of waiting for the car to break down, we should actually wait and give it regular service. So this was an eye opener for my child. I will now ensure that I give him his age-wise checkup required for his eyes, and I'm sure this will make me ensure better vision for my child.
I came along with my team to attend a very informative session for children eyesight and their vision related with this topic. Dr. Maharwal, who's a pediatric ophthalmologist, he helped us and he gave us a lot of information how to take care of our children's eyes, and in this current era, how can we take preventions and precautions to improve their vision and eyesight. So thanks a lot, school and ma'am, to give us this opportunity to attend this beautiful and very informative session. Please keep informing us, and please do give us more opportunity to attend such a very informative session in future.